7 times bigger than I'm used to, which is okay. You know, elections, it's all the same work. No matter.
Same way.
Yeah, smoked fish, and I'm like, not when
With
it's
the head still on it?
Yeah, when it's looking back at me, I have a problem with that.
Don't look at me.
I went to a Chinese dim sum, an actual Chinese Chinatown dim sum dinner.
Chicago, Chinatown?
LA.
Oh,
Yeah,
I love LA a lot.
I did too, but I did not enjoy that dinner. I ate jellyfish. And I
Really?
didn't know it. And I was like, this is some really chewy noodles. Like, and they were
Like what? That's like plastic.
a little bit.
I don't know.
And I didn't
Not
know
quite,
it
but I mean,
had
just
no flavor. Just the garlic and the butter on it. And we'd taken a break to go outside, and someone's like, "Oh my God, that jellyfish was delicious." And I'm like, "What now?" I said, "What?" She was the last course. I said, "What did I just eat?" She goes, "Jellyfish." I'm like, "Oh my God."
You mean the noodles? Oh my goodness.
Yeah, I'm like,
that's what it
those
is. And
weren't,
then you don't know which,
like those weren't
probably want to speak to
Yeah.
that. Well, they're pretty darn close.
Oh, they're working
Yeah.
on it.
Exterior's done. They're working on
Really?
some last minute landscaping.
Hydrant fenced in, so if the fire department had a call, it'd say As soon as I do, I'll let you know, because then you'll probably join us, right? Because you're right next door.
That was one of the reasons. Oh, look
Oh,
at
Rosalie,
you.
yeah.
Hi.
That's right, there's Nick.
And who's this fella here?
It's been a little while.
Right.
I mean, you know
Yo, Nick and Tony.
oh, Nick and Tony.
Tony.
They got you mixed up one day.
Okay.
They both had masks on.
I look
Wear
like
glasses.
a lot of people.
Okay. 1 minute to go.
That's right. Rosalie, did you have a nice dinner tonight? You did?
Bring me any leftovers?
All right, at 6 p.m., so the license held committee meeting come to order. So I would like to, I don't think we need a roll call, really, I don't think we do, because I believe we're all present.
Present.
So approval of the minutes drafted in the license and health special meeting of March 16, 2021.
Move for approval, Mr. Chair.
Second.
All in favor of the motion?
Aye.
Opposed? The ayes have it. We do have new and previous matters. The new matter for introduction is Class B Tavern license for SU Plus 2 LLC DBA SU Plus 2 located at 7028 West Greenfield Avenue. Agent Sapa Wady Pemoto, I believe.
She's here. Do you want to come on up to the
You want to
table?
come forward? You applied for new, a court license, right?
Yeah.
You had other places, any place else?
No.
No, this is first time for you?
Yes.
So, and Alderman, have any questions?
Actually, Mr. Chair, I have a question. Just for clarity, 7028 West Greenfield Avenue, is that the former Urban Joe Cafe?
Yes, it's Urban Joe Cafe.
Okay, I thought so. I
currently-
thought I recognized it.
Yeah, currently
So-
we're still operating under Urban Joe Cafe.
Okay.
We're planning to change the name, but
All right, and from my understanding, there is already a Class B tavern license for that establishment, correct?
Yeah.
Okay. All right, I did have one question as far as your operating hours. It was listed, I believe, until 2:30 a.m. Are you planning to have that more run as a tavern?
well, we
through the
were.
night?
Well, our hours is until 9 p.m. But we
Okay.
were just like, well, just to be safe, you don't want to just cut short hours and then, just have the hours length as much as possible. But hour is always just until 9 p.m. anyway.
Okay,
We
so
just didn't want to cut it
you're
short.
looking more to run this and operate it as Urban Joe's was, as a restaurant, and just
Yeah.
serve beverages?
Yeah,
So,
we just maybe more on the evening too.
Okay, the only problem I would have is the hours, and that we could reduce that to
Yeah, you
a reasonable time and let that be reflective. Otherwise, that's the issue I would have.
Mr. Chair,
Yes, Alderman Road.
sticking with the hours, as Alderman Grisham started out with, you're also open at 6 a.m. in the morning,
Now it's 8 a.m.
but we're looking at 6.
Yeah, I mean that's
And that's when you can start serving alcohol.
I asked my husband. He told me to put that down, but whatever
I think
the
we're gonna have
city
to-
recommended, we'll go with what you.
I would like to see the hours tweaked somehow. And then another question, and maybe along with the hours, and I guess there's also a parklet there. Is that part of the extension of premises? I know they can eat out there, but can they drink out there as part of it as well? I don't have it in front of me,
It depends on what the committee approves as the licensed premises. So if you include that area, they could drink out there, serve alcohol out there, yes. If it's not included, then no.
and the way it's in front of us now, they could be drinking out there at 6 in the morning.
Correct, if that's the way the premises is approved. Now, the committee could put conditions on any license, any new application. So part of those conditions would be, we are going to approve you for a liquor license or an alcohol license Class B for the hours of X to Z, and if she agrees to that, and then that's the conditions on the license, we can do that live right now. In terms of the location outside, we can put conditions further on that as well, as long as they're going to remain or would be on the actual license that gets issued.
Mr. Chair?
Yes, Alderman Stefanowski.
Do we know what they currently are for operating hours with Urban Joe as far as their alcohol license is concerned?
I do not. I'm not sure if the clerk says that.
I do not know that. What are your current hours as Urban Joe's?
Currently,
Yeah.
it's 8 a.m. to 2 p.m. and 4:30 to 9 p.m.
That's right, you guys take a break in between. Okay.
Because I believe they currently, if I remember correctly, and a gentleman who just walked in could possibly verify for me, I believe they are allowed to sell alcohol right now in the morning at 8 o'clock at Urban Joe.
Aye.
I'm trying to remember, Jim.
It was 8 o'clock.
That's what I was wondering if you remembered or not, because I couldn't remember.
Mr. Chair?
Yes.
If I may,
Question?
I don't have a problem with having a mimosa at 8 a.m., to be honest with you. So I would not have an issue whatsoever as a start time.
That's
You
why I
know,
was
as
kind
far
of-
as 8 a.m. I think 6 p.m., you're probably just covering your bases.
Yeah.
But I think we can tighten that up a little
Yeah,
bit. Let's go
totally.
the 8 until, with 10 p.m.
No, that's
Give you
fine.
adequate time for serving
Sure.
if you so chose to keep your restaurant open
Yes.
at that time. I mean, if at all, can she come back and request
An
you know,
extended hours, yeah.
extension to that or a new condition? I think that would be fine. Now, my issue with a parklet, and I guess I need to know, we have extension of use on most premises. It was a thing through COVID, and it's really taken off, but I haven't heard much about parklets. But I know Urban Joe's design and what your design would be with the parklet is people use the sidewalk still for passage, and the parklet is out here.
Right.
Am I correct on that?
No,
So
opposite.
it's the opposite.
The parklet is the walk-around part, and you eat on the
On the
sidewalk.
sidewalk, yeah.
Okay, so that would be the closest to the
The eaters
door.
aren't out in
Yeah.
the street.
Okay, then I have no issue with that because that would be the closest to the door. My issue would be going out into the street
Yeah.
with that. So if anybody else doesn't have any questions, I make
No,
a
I don't
motion
think
for
we have any
approval.
problem with it. Is there a motion for approval?
I do have one
go
question.
ahead.
I'm sorry. So there is a license currently for Urban Joe's. Are they going to be surrendering that license?
I believe so, yes. By parliamentary.
Because this application is for the current period we're in, 20 to 21, so they're concurrently renewing as well. So as soon as this is approved and issued, then Urban Joe's will surrender theirs.
Okay, just making sure that they actually do that.
Yep.
Okay, as long as the record reflects that, that's fine. So if
As-
we can,
So,
It certainly could be a condition that this is approved as of Urban Joe's surrendering their license as well.
okay, then I make the motion to approve based on those conditions that Urban Joe's will surrender their license, that a new liquor license will be issued to 7028, and the conditions of liquor service would be from 8 a.m.
8 a.m.
to 10 p.m.
Okay.
second.
All in favor of the motion?
Aye.
Could I have a question?
Yeah, go ahead, Alderman
Mr. Chair,
Blanke.
please. When will you construct the padlock on site?
The parklet,
It's already there.
it's already there.
It's already there, yeah.
It's already there?
Yes.
Oh, I wasn't aware of that. Thank you.
So we have a motion?
All in favor?
All in favors?
I
Opposed? The ayes have it.
Wish you the best. I'm really
Take
glad
care.
to see you.
Thank you so much.
Thank you.
Good luck to you.
You want to check?
So then, we move on with 2021-03 25, application of transfer of license from premise to premise of a combination, what do I?
That's Class A liquor for State
Yeah.
Fair Liquor?
Yeah, from State Fair Liquor and Food Mart from 1568 South 81st Street to 7920 West National Avenue. Yes, you right? Yes.
Mr. Chair?
Yes,
I have a few questions.
that's your district, so.
Well, actually, no, it's not.
no, that's
The-
us.
The next one will be.
The next one.
And your name is?
Pavitra Haldar.
Okay, I'm not going to slaughter that, so thank you for, sir, for letting me know, but honestly, I will slaughter it either way. I do have a couple questions for you. State Fair Liquor, I'm familiar with it because I used to work at a barber shop right next door to that area, and it was the former Jerry's Liquor Store, if I remember correctly.
I think yes.
Yes, so, but the 7920 West National address, is that the current BP gas station?
Yes, yes.
Okay, so if you're looking to transfer this license from the liquor store to, are you going to keep it as a gas station, or do you want to make it just a liquor store?
Keep as a gas station plus I adding there is liquor store.
Okay, and you were working with Steve Scherer on this, right? Or trying to
Yes,
find a
yes.
location? Had you come before us before with the Highway 100 location? Am
Yes,
I-
yes.
Okay,
Three
so.
times. Yeah, this is three
So you're
time.
really working hard to try to find a
Yes, yes.
location. However, my concerns would be that of a gas station, that you would be turning that into a liquor store. Even with an added building, I would not be a huge advocate for that. If you were not doing the gas station aspect of it, I would consider it, but not with moving it with a BP gas station, because as of now, and I don't want to speak for the whole council, but we had speedways and other gas stations that have come to us, and we didn't approve. We did approve one on a temporary basis through this year, but that was just for malt beverages. You're looking to move an entire liquor store. I really would hope that you can find a fit for that for you. And this hasn't gone to vote, but that's my personal take on it.
Yeah, I would like to ask you, is that to a separated section of the gas station and the liquor store
Yes.
that you're looking for?
Yes.
So won't be no entryway from the gas stations at all, right?
No. Everything separate.
So you're going to sell fully liquors, right? I mean,
Yes.
from beer to everything, right?
Yeah.
So basically, to me, it would be just a liquor store. I mean, even though it's adjacent
That's the floor plan.
with the BP gas stations, So I don't know what. Any other question from the members?
Mr. Chair?
Yes, Alderman.
I believe, and someone's going to have to help, we turned you down about 6 months ago for a beer-only license, correct?
No.
Not him, no.
That was different.
No.
I thought we're talking BP on 79th and,
And National.
okay. I'm mistaken then, sorry.
No, Mr. Chair, if
Yes.
I may add, I believe this gentleman has come, like I said, he was looking for a new location for his liquor store, and he's going to surrender the old license and just do a transfer. So he doesn't want to operate like multiple liquor stores. He's just really trying to find a new location for the State Fair Liquor. That's on 81st and Lapham.
I'm sorry. You don't own the gas station now then, you own the liquor store.
Yeah, I own liquor store.
Okay, but wasn't the BP guy here 6 months ago for a beer license only there? I'm sure of it.
I don't think
And I don't know,
so.
I'm
Maybe.
just-
Call that.
Could be.
But, Mr.
Yes,
Chair, I do
yes.
have another question. Would you be operating both businesses then? Are you making this a separate business to that? Would there be a secondary address? How does this work?
Maybe I can do separate business like operating system. Everything separate. It's gas station and plus the liquor store.
Okay, so if you had the gas station and then you built on and added the liquor store, you would have to have multiple employees, one running the liquor store, one running the gas station.
Yes.
And there would be no access from the gas station to the liquor store. It would be completely separate.
Okay.
I'm asking, I'm sorry.
Yes, yes.
Okay.
Because that's why I adding separate building, separate entrance, everything separate I did.
Okay, I think in fairness, we would really need to see how this is going to look.
It's right there.
Yeah, right there.
But if we were looking here, it looks like everything's all in one business. So this is adding new building here, but there's liquor, okay, so
That's,
there's still a coffee counter. grocery soda. It doesn't look like it's separate. It looks like there's a coffee counter right in the center. Doesn't look like it's a separate building.
Would it be helpful if I go try to find Steve Shear? if
Could
he's
you?
involved? Yeah,
That would
I
be
can go take
great.
a quick trip. The only other thing I was going to point out is that I think where we're discussing is 9.02 13C talks about Class A's and gasoline, and so there's two things I want to make sure the committee's aware of. It either has to be only beer, or there has to be separate entrances for both. And so those are the conditions, and I know that's the route you're on right now.
Right.
If
That's
I'm going to
right.
run away, I want to make sure that we were clear on that.
Okay, super.
Be right back.
So we'll just wait for
Yeah, we can hold
Mr.
it.
Scher to come in and share.
Sure.
He's full of humor tonight.
Mr. Chair?
Yeah.
Well, he's finding out the answer to our question. Under the license addendum, it indicates that you didn't complete a beverage service training course in the state of Wisconsin. It says no, but yet on the next page, you do have a certificate, so I'm a little confused. Why did you put no if you did take the beverage course?
I don't understand.
Okay. You have the license application.
Oh, okay.
And it said that you didn't complete it, but yet there is a certificate here on the next page that indicates that you did complete it. So I'm asking you why you put no.
You may have accidentally
Maybe
just put no.
yes.
Yeah, I'm sure
He's
that's-
actually in business already, so he would have had to do that.
My question to you is, have you completed it? Have you completed a beverage course?
Yes.
All right, that's what I wanted to know. Thank you.
Any other questions? I know we wait for the,
Yeah, don't have to.
I still think he's looking for Steve, right?
yeah, I wonder if I can,
Should we put this on hold until Steve can,
yeah, we can
Just
go on, I think.
in light of time?
Let's
'Cause
do
we
the
really
last
have a half an
one.
hour.
Let's do the last one.
okay.
Number
Would you
6.
mind just we'll put this on hold for a moment
Yeah.
until we get
Yeah,
Mr.
sure.
Scher in here to discuss,
So
okay?
we
Thank you.
move on with item 6, which is a temporary permit extension for John Star Pickle LLC, DBA Broken Star, 1100 South 60th. He's here? He's not here, eh?
John Starr's not here? He's been
Okay.
notified 3 times.
All right, well,
Well,
I
then,
put a,
then if it's the case, if it's been notified 3 times, I'd like to not approve it, for denial of the applications. 3
Second.
times is no reason for.
Second.
All in favor of the motion?
Aye.
Opposed? The ayes have it. So,
would that be denial, or would that be to place on file? Or is that
denial.
denial?
The motion was
Okay.
denial, and I think it'd be appropriate.
Okay,
That's
all
not
right,
appropriate.
okay,
Appearances.
so,
Based on 3 non-appearances.
absolutely,
That's right.
okay.
Just to report back to the committee,
Yes.
Steve is not upstairs. We tried calling him, and he's not available right now, so
Okay.
I don't have any additional information.
Okay, then I would make a motion to hold this item until we can find more information as to where the direction of this business is going.
I'll second that.
So he has to really make sure that he has a separate entrance, not connected.
like to come back
Yeah,
up.
come
You can
in, come
have a
in. So you do understand that we're holding it, okay?
Okay.
But we want to make sure that the entryway, business people, they come to give you business in a liquor store, has to be away from the gas stations. No entryway. You know what I'm saying? You can't just go from here to here. So you got to come in from here, or just go out from the back or front, but not go into the gas station facilities,
Okay.
So that's one thing you want to make sure, because if you don't have that, because you're going to have a full liquor operation. It's not just beer, so that's the reason. So make sure that we're on the same
Everything's
page, you know. I don't want you to waste your time, really. I don't, you know, because you come back again, you don't have the proper layout. It's going to be a private entrance, like our assistant city attorney addressed earlier, you know. Well, then we're in the same boat. I mean, you know, we're not going to approve it, okay? So make sure that something gets modified if it's not. So I don't know, probably it's totally appropriate the way you have it, but I'm not an engineer, no, so.
I'll ask Steve for a report or an email
Yes.
to the committee tomorrow, trying to detail what the plans are, what his
Very good.
understanding of the process
Very
is.
good, Nick. Thank you, then.
Thank you.
So get a new date.
Do we need to make a motion to place on hold?
I made a motion to place on hold.
Okay, all right, second. If
All in
nobody
favor?
seconded it.
Already seconded.
Okay,
So, all in favor of the motion?
aye.
Aye.
Opposed?
Aye.
The ayes have it. So then we go back to item, you know, that's a previous matter for consideration is the 2021-0139 Class A retailer license for the sales of fermented malt beverage for the July 1st, 2020 to June 28th, 21 licensing period for the State Fair Petrol Mart Incorporation, DBA State Fair Petrol Mart, 8404 West Greenfield Avenue. Agent Gunder Nagra, new non-existing location, gas station. Mr. Nagra is here?
Yes, sir. Good evening, Chair.
So I'm sure we already been in front of us, you know.
Yes, sir.
So at this point, we appreciate that you're here again, you know. Any question from the committee members at this time?
Mr. Chair?
Yes.
You go ahead, Lisa.
No, that's good.
I wanted to bring we have a few residents in the neighborhood that have come tonight to speak. There was a problem, I just wanted to bring it to your attention. When we had the public hearing, there was a miscommunication, and we also had some problem with our live streaming. So I was unaware as an older person that some of our residents adjacent to the property are conflicted with the hours of operation. I know this might not be the forum for it. However, as the owner of this new business, I think it's very important, imperative that you hear from those neighbors regarding their concerns, and if that's relative to the liquor license or otherwise. I can speak personally as your alder that I am not in favor of the liquor license at this time. There's a number of reasons why. However, I believe that we have a sufficient amount of liquor stores in the area. For one, we have a operating business that has been a longer standing business at Express Pantry. And the fact that I don't feel that the liquor and gasoline go hand in hand. Now, I don't know how that's going to impact your sales. I know that you said 20%, but one of my biggest concerns were when I was more in favor of this is that, okay, you're going to have a few coolers. It was going to be maintained, and really what put me over the edge is the beer cave. You know, having 12-plus coolers, you know, when even just up the block, you know, he might have that in his total business.
I mean, if that was the issue, I mean, you could, I can take the recommendations, I can reduce the beer cave to just being the cooler doors, if that's something you want.
I don't know that that is going to change my opinion as of now because of the reasons that I stated. Like I said, there's adequate businesses in the area that have liquor licenses right now, and we're kind of setting a standard going forward that we're issuing, you know, every gas station on the corner a malt beverage license. So with that being said, I just didn't feel even your layout was really what you had expressed was going to happen. I thought, you know, it was going to be more towards the counter. You have it way off in another section. That's, you know, a cave to go in. It just doesn't seem like it would be as easily maintained. And those are my biggest concerns. So I'm not in favor.
So any questions? from-
Rosalie had
Mr.
something.
Chair?
Rosalie, yes,
Thank you.
sure.
My concern is the layout of your beer cave. I've noted that there's 10 doors, that you plan on having 10 coolers servicing the beer aspect of your business. That concerns me. It concerns me because there are other businesses in the area, and and I indicated that on the council floor last meeting. I hesitate to support this because it seems like it's more of a beer depot with the beer cave installed the way you planned on it. I probably would change direction if I knew that you weren't going to have such a large amount of the beer. 10 coolers is a lot of beer.
But when-
And I don't want you to come to the point where there will be other businesses affected because you have
Sure.
supposedly a beer depot on site.
Sure, I understand that.
It sounds like you are enlarging the store totally for this beer cave, and that concerns me.
No, that was not the intention, actually. I had to make the building, it was kind of the way it's set up now. I had to make it square. That's why I had to make the addition. I mean, when I sent the plan to the city, I asked Steve to, whatever recommendations he gave us, I turned my plan according to that. If somebody had mentioned that they would recommend less coolers, I could have gone with 5 coolers for the beer. But nobody recommended me that, so that's why we are sitting here now.
Indicated 10 doors.
No,
10
but
doors.
that was my proposal to the city, and then if Steve or somebody would have come back to me, that, oh, we are only going to approve you 5 doors, I could have done that. Because I made other recommendations, whatever the recommended, I made all the changes accordingly.
Okay. Last meeting, it was indicating that the garage part where they repaired cars
Mm-hmm.
is where this beer depot is going to, I keep saying beer depot, but to me, it's an enlarged amount of beer for a gas station. I
just
wish you
appro-
would promote your gas more than you would your beer, or your grocery store.
I could have reduced my dose to that.
May I talk?
Yes.
Thank you. We don't have a store in that area that sells food, like a Pick and Save or anything like that, so that's a mile away. Had you considered going more into the food aspect versus the beer aspect?
I'm going to have some groceries there.
You do have, yes, you
Yes.
do have 30% groceries.
Yes, I have two
Yes, you
items.
have indicated that, but instead of selling,
Yeah, but the gas station setup it's never going to be a Pick and Save. It'll be a convenience store.
no, but I'm saying that the neighborhood probably could use something of that nature, because a Pick and Save or any food store is a mile away. Now, wouldn't you adhere your business to what the neighborhood probably could use?
Sure. I'll think about it.
Versus
Yeah.
beer? I mean, we have a block away, we have another station that is selling beer. We have a convenience store that is selling beer. We have Walgreens probably that's selling beer. I wished you would probably rethink your
Sure,
your plan.
Sure.
Thank you.
You're welcome.
Mr. Chair.
Any questions? Yeah.
Just
Alderman
wanted to let you know, in
Yes.
case you guys haven't seen, we got another email forwarded from Mayor Devine that's a neighbor that's not in favor of this as well. It came right before the meeting, so just
Okay,
wanted to
I
let you
didn't
know.
catch it, but
I-
thank you.
I got it right here, so I just want to let you know.
So what
Okay.
he said that,
Not in favor of it, so something for you guys to
Yeah.
look at later.
any other questions from the committee members?
Mr. Chair?
Yes.
I have a question for you.
Yes, ma'am.
One of the hours of operation, and I need to address this because I wasn't able to discuss that with you prior because I didn't realize that it was going to be an issue for some of the neighbors. So if you do not have beer sales, and I know that wouldn't matter because it's only till 9 p.m.
Sure.
Do you still plan on operating your business 24/7? Or are you going to have a plan going forward to kind of see how your sales are, and then maybe,
No, for now, I'll keep it 24 hours if that's okay with the committee.
okay,
Then, I mean, I can, if the business is not there, I can always reduce it
okay. And
from the next cycle, next license cycle.
okay, and Nick, actually, we wouldn't decide on that, on the hours of operation of the business, unless we were approving the liquor license, correct?
Correct,
So that was already approved. So we don't really have a say in that now because it was already approved. Your business is ready to go.
Sure. I mean, if I don't see the business is not that great at nighttime, in the next cycle, I might consider putting the hours from 5 to midnight or something.
Okay, and that is what I explained to the neighbors. I mean, I am happy that you're coming to the community. I think when we have businesses that are operating 24/7, we always have concerns.
Sure.
You know, because especially on 84th, you're right by the freeway. You know, I will quote one of the neighbors, "Nothing good comes of 24/7 operations," but that's probably based on bad experiences in past with a gas station that may have been there. So I just want you to be more cognizant of that going in, and I hope that you really work really well with the neighbors and have an opportunity to communicate on things. There's a gentleman with his hand raised in the back.
Well, let's first,
Right, so-
and then we can ask some of the
Right.
citizen, come forward or see if they have any questions. I mean, I don't want somebody interfering with the,
Exactly.
with their meeting right now.
So that pretty much covers what I
So-
need to say.
So the fact it is that if you reduce having less doors, what would be the problem for you?
I mean, now the committee gave me the recommendations, I can always do that. I can go from 10 doors to 5, if that solves the...
Even to 3. I mean, in fairness, really, I feel the difference is that you can keep it loading, whether it's 10 or 5 or 8, you can still keep loading up the, if you got 3, well, you can still keep loading them up. If you see that the stack is down, well, you can just load it up. So the fact is, if the committee really wishes to move forward with this, even with 3 doors, I mean, and again, we got time restraint. By 9 p.m., you cannot sell anymore.
Yes.
Like, beer. That's the way it works. So myself, I feel that already in some locations, we do. In the past, we did approve some of the beer sales, and so and the investment, the way I look at it, that you apply to that corner. I mean, to me, like older person Christian, she said the same thing. It's very nice for you to really come forward and invest money in our community, But then again, if the members, not really agree upon, that's the way the democratic process work, For me, if it was 3 doors, I think I would be in favor, and I will move on, I understand there is some concern from the neighbors, and I would like to give them a chance to come forward and address their concern just as well, so at this point, we need, yes.
Nick's got something.
Yes.
Briefly, there's been a few talks about various amounts of doors. If we're going to license a premises, that premises will be licensed unless there's a condition placed on the property. One of the conditions that we have in our code is to maintain it consistent with the layout plan. So if there's any approval, I would need that to be part of the motion. Otherwise, the entire premises, whether you want it to be 3 doors or whatever he wants it to be, is going to be in play.
So the motion is going to be stated based on the,
If it's for approval, it would have to be limiting it to a certain floor plan, which doesn't sound like that floor plan's in place right now. It sounds like there's 10 doors, so I'm just cautioning the committee to be careful there.
Mr. Chair?
yes.
My understanding, as Nick had just outlined, is if we are going to suggest something like that, what he has to do is go back to planning, and it will have to be amended. So at this juncture, as I said, I'm not in support of the plan, whether it's 3 or 10. So I would make a motion to deny.
Second.
And just for the record, that motion was based on there's sufficient number of establishments in the area already. There was the community concern in the area and our concern about alcohol and gasoline.
Correct.
All right. And is that the motion?
That is the motion, thank you.
And the second?
Wrote. Oh, both
Yeah.
of you.
You can have it.
So the motion is of denial,
Correct.
based on the layout.
No.
No, based on everything.
what
Nick
Based on
said,
what
the
Nick just
too
said,
many in the
based on
neighborhood
community
and-
Community
concern.
concern, well, that's one of them.
And gasoline and alcohol not mixing.
Okay. All in favor of the motion of denial?
Aye. Mr. Chair?
Yes, no?
No. Now, since we've already gone through the motion of denial, is this something that we say going forward, the neighbors who did want to speak, that gentleman in the
Yes.
back did raise his hand, can we utilize this
Sure,
forum
go
to
ahead.
give them a floor for a moment, considering they did not have that floor during the public hearing? Or would you like to take this personally?
It's up
No,
to
we
the,
can discuss it here because there's a number of us that are immediate neighbors in the neighborhood. For me, I own a property right next door to the gas station, or currently gas auto repair shop. It used to be a gas station years ago and has had a few renditions of it, but I have a number of concerns about it.
If you could hold tight just a second. For the record, we would probably bring this gentleman forward, state
Yes.
his name, so we at least have a record that you have been here. So would you mind if a couple of the residents do come forward? They can come forward here.
Yes.
And maybe you guys can share the
I can-
information afterwards, please.
can sit back?
Yes, thank you.
Before we continue with the citizen or neighbors concerned, Nick, so the applicant, they could go back to the development department and change some of the plans.
The applicant could change the plans that he's submitting to this committee and submit it again and reapply with some alternate or changed plans. Could go back to planning and reevaluate that. He might not have to go back to planning if that's been approved. The liquor license is the purview of this committee. And so
Correct.
if you limit it to certain things, I would want to see it in writing, obviously, and probably a plan of operation that would reflect that. But he can certainly reapply as many times as he sees fit.
Yes. So did you understand? You did, right? So he can work with planning department if you wish to follow through, okay? So I don't think you need, I don't know, if you want to stay around until the common council meeting, it's up to you, you know? So go ahead, sir.
Mr. Chair?
Yes.
Actually, Alderwoman
Well,
Ranky
Nick.
has something to say.
If he redoes the plan, how long does he have to come back to the committee for?
Whenever he wants. There's not a quota or anything
There isn't
anymore,
any
so he
time.
can come back and reapply, and it can be denied, and he can come back and reapply, and it can be denied. As long as he wants to keep on trying, he can continue.
Okay, thank you.
And Mr. Chair, if I just may
Yes.
add, we do have a couple residents here. If we could limit our time, because we are needed in our next meeting. I don't want to not give you the floor, but,
we'll give him 10 minutes for
well,
everybody.
10 minutes.
10
no.
minutes. No, not each, all of them.
Okay.
Whoever wants to
I-
come forward.
I think just a couple minutes each
Couple
would be
minutes.
It's
sufficient.
at 6:30, right?
It is
Yeah.
6:30.
Okay.
It's 6:36, and we're due in our next meeting, so,
Yeah.
We do have the person waiting, so that works.
So we can do it 5 minutes then,
okay.
for everyone.
Go ahead,
Okay.
sir, if you could just
What do
state
you
your
need?
name.
Name and address.
Name, Gail Roberts,
gotta wrap this up.
address 1359 South 84th. I have a number of concerns. One is security, one is property values of running a 24-hour store on a corner there, even a gas station. I've lived there since 1984 and have had some security issues in the past, both with the gas station there and the repair facility. He does have cameras there now, and it has alleviated some of it, but there's still been people that have gone behind the gas station, through the fences, over the fences, in a variety of ways. My garage was broken into, my house was broken into at some point in time. Making this a 24-hour open store, it's going to possibly attract
Undesirables.
in the neighborhood. And that concerns me. And one of the reasons the house there and being broken into again, the loitering or garbage around. I have enough to pick up during Fair Week to begin with when Fair Week goes on, because they leave garbage all over the place. But at some point I want to sell that house, and I don't want to destroy the property values with a 24-hour.
Mr. Chair?
Yes.
I'm actually, and I appreciate your time here. This is highly unusual that we do invite, obviously, we
normally
denied the
we don't,
license.
really. I mean, that's-
And as your representative for District 3, I want to extend an invitation to you that you and I have a personal conversation regarding this. So at this time, I'm really sorry. I do know that Mr. Miller and I had a very similar conversation, and I will be sure as a representative to share with Alderwoman Keene too your concerns. And this gentleman is going to run a very reputable business. I wish him luck in business, and I think that we can all work together. So thank you. Thank you for coming tonight. I appreciate it.
Just to bolster that, so
Yes, ma'am.
because it's been denied, this is, by Robert's rules, this wasn't really an item. I was going to let it go for a while, so I'm just trying to be, I'll be the bad guy, because we shouldn't be going down this route very much.
It wasn't
I
on the
appreciate it.
agenda.
Yep.
So I believe anybody else like to say? Go ahead.
No, I think we're
you
going
guys
to
happy
make a
with that? I mean,
motion to adjourn.
I would like to give everyone the opportunity as long as we're on this. I don't
Well,
wanna-
if it's something different, I guess. I mean, mine would be similar to Kale's, I guess. I don't know what this gentleman's concerns are.
Okay.
And again, I think they can be addressed with the alderpersons of the district at this point.
Yeah.
Was item 4 addressed already?
No, we got to put,
All right.
motion to place on file.
Thank you.
Chair.
Yes. All in favor of the motion to place on file?
Real quick,
Yes.
there was somebody that we wanted to bring in, correct?
Yes.
I would request that we bring in the owner of Just Jay's.
I second that.
I will caution the committee that if we bring them in, that we cannot do a enforcement action against them. So if you would prefer, I can evaluate whether we can go forward on a license and health summons a complaint, as opposed to bringing them in here to have a discussion.
And then let us know.
Is your goal to potentially bring a complaint?
Correct.
Yeah, we want to
Potentially.
discuss the issues that
All right,
are
I will draft something, and it'll be up to the committee if you want to uphold that or not, but that will be,
Okay.
I'll go that route so that you can actually take some action.
Okay.
Okay.
All right, thank you.
Got it.
Okay, you're going to
Yeah,
remove
so
your
I'll
motion?
remove my motion.
Move your motion
Okay,
then?
second. Move to adjourn.
Second. All in favor of the
Aye.
adjournment?
Thank you for coming, everyone.
Opposed? The aye. Very good.
I did.
Hi, Rosie.
Oh, yeah.
Thank you, Dan. You too.
I'll take it.
Yep. I know. That's how it works. Okay. So, yes, regarding item 12, what I'm going to do is...
Still got the salads.
Yeah. So when this report comes up, what you could say is, would the chair like to...
Yeah, I don't know where he was.
Okay, he's here. Or actually, Mayor will say the...
Oh, there he is. Chairman, our license and health
report,
meeting.
and then he'll say yes, and you can say number 6 on the license and health agenda, which I think is actually... I agree.
Hey, Paula, can you hear us?
You can just simply say it was... that person should have-
Can you hear me okay?
could be
Yep.
reopened, or at least
Can you just give us a mic check?
Yep. Can you hear me okay? Check.
Yes.
And I'll jump up to the mic. Yep, we're all set.
The meeting of the committee of whole will come to order. Let it be noted all members are present. First order of business is approval of the minutes of May 3rd, 2021 committee of the whole meeting.
So move.
Second. It's been moved and seconded for approval of minutes. Any discussion? All in favor?
Aye.
Opposed? Carried. Item 2 on the agenda is a presentation on race, racism, and public health by Paula Tron Enzio, Mobilizing Action Toward Community Health Group Director, University of Wisconsin Population Health Institute. Ms. Enzio, you can have the floor now.
Thank you so much, and thank you so much for having me tonight. Can I share my screen?
You're on a large screen here.
I think I need some Zoom controls to be able to share slides.
Gotcha.
Great.
Should be set.
Great, thanks so much. I'm just confirming that you are seeing the correct view. Is that right?
Someone confirm.
We can see your presentation.
Great, thank you so much. As was stated, I'll be talking about race, racism, and public health today, and thanks so much for sending your diversity, equity, and inclusion report in advance. It was great to see that kind of work happening, lots of progress happening at the city level. So again, I'm from the Population Health Institute. We are based at UW-Madison, but have a statewide footprint. So really work in partnership with organizations and community-based groups and leaders all around the state. We are one of 4 units within the Population Health Institute, the County Health Rankings and Roadmaps, our evaluation research group, health policy, and our work really leans into efforts to advance health equity here in our state of Wisconsin. So just to open up, want to offer a broad definition of health, and I think a lot of the slides that I'll cover today will hopefully be repetition, things that you all have heard before. We've been present across the city for several trainings and have seen some of your staff give training. So I hope a lot of this information will just complement things that you already know, but happy for folks to flag me down if you need me to pause or clarify anything. So we draw on a broad definition of health using the World Health Organization definition that health is not just the absence of disease, but really thinking about full well-being that encompasses physical, social, emotional, and mental well-being. and want to offer this particular definition of public health. This is a bit broader than statutory definitions of public health, and we really view public health as what we all do as society collectively to ensure the conditions for all people to be healthy and thrive. So this means that public health agencies are certainly a key part of this picture, but as you can see here, it also takes the work of neighborhood organizations, nonprofits, mental health groups, faith institutions, law enforcement, doctors, hospitals, the whole range of stakeholders across an entire community to think about how we are moving ahead decisions and policies and practices that allow all members of our community to thrive. Some definitions, you'll see a lot of language around disparities and inequity, and just want to offer some specificity around the language of inequity, especially as we think about the field of public health overall. Disparity is what we consider to be an umbrella term. It's a population-based difference in health outcomes. An example is that women have more breast cancer than men. But when we look at disparity data, we can't always tell the driving forces. So for folks that care about prevention, wanting to prevent disease and ensure wellness, it can be difficult to only think about disparities. So over time, the field of public health has offered more specificity when we talk about the language of inequity. So all inequities are a disparity, but not all disparities are inequities. We think about inequities as particular disparities that are based on socially determined circumstances. So things that the stakeholders of the image that I showed you previously make decisions around. For example, we have observed that over time, American Indian populations have higher rates of diabetes due to the disruption of their way of life, due to replacement of traditional foods with unhealthy commodity foods. So this was a particular set of policies that really shaped the diet and food intake of American Indians in particular. So in a patterned way, we have observed that over time, in relationship to this policy, American Indians have increased rates of several chronic health conditions, but diabetes lifted up here. And when we describe disparities as inequities, we get closer and closer to actions, which by definition, inequities are actionable things that we as community leaders, decision makers, and researchers can really hone in on to change, to really promote health and well-being and prevent disease. So health equity then means that everyone has a fair and just opportunity to be healthy. And I'm underlining that word opportunity. I'll pick up on that throughout my conversation today. And it requires us to remove obstacles to health, such as poverty, discrimination, and the consequences related to those conditions. This includes powerlessness and lack of access to good jobs with fair pay, quality education, housing, safe environments, and health care. And this is becoming more and more the standard definition that's shared across the US related to how we think about health and well-being and how we measure our progress towards health and well-being. As I think about defining equity, and this I think mirrors some of the language that's in your report as well, want to lift up the distinction around between equality and equity. And I think this has particular importance for especially those that are making decisions around policies and practices and resource allocation. So these are both concepts of fairness, but equality is really about sameness. It judges whether or not everyone is receiving the same thing. And really this framework can only work well if everyone starts from the same place. But as we know, many of our community members over time are not starting from the same place. So equity is a more appropriate approach to think about how we are shaping policies and practices to assure that everyone gets a shot at the same opportunities, that we are making adjustments to make sure we reflect differences in histories, barriers to participation, and opportunities. Often in my trainings, I get folks that sort of have reflections and comparisons and metaphors. And one training participant shared with me when they thought about this, they thought, wow, it's sort of like parenting. When you have two kids that are You love them equally, but they are quite different individuals. Your parenting approaches need to be equitable and not equal, right? In order to assure that you are being responsive to their assets and their talents and their needs. So while you might love them equally, your parenting approaches with each individual child needs to be equitable in order to ensure that each of those children have all of the things that they need to thrive and be their best selves. So this sort of sets the framework and foundational definitions for the racism is a public health crisis. This work really comes after decades of partnership engagement across not just our state, but nationally, to really think about the role racism in particular plays as it relates to public health. And a few years ago, several of our state leaders came together and said, you know, we're at a point where racism is a driver of public health outcomes that have reached crisis state. And these are some of the key pieces of evidence and rationale that those leaders identified to lift up that statement. That race is a social construction that's not based on biology. It's actually based on how genes express through phenotypes. And that racism is a social system that really implicates many different parts of our community and our societies and our structures. And it structures opportunity based on an assignment of value on how someone looks. So not the internal biological makeup of their persons or their bodies, but how they look outwardly. And this social assignment has created unfair advantages for some and unfair disadvantages for some. And this is patterned across race, which is, has been sort of socially defined and constructed. We also have observed through many studies, from economic studies to social policy studies, that racism saps the strengths of our societies and wastes human resources through persistent racial discrimination. And we have at least, this was written several years ago, at least 100 research studies, empirical studies, that really links the role of racism to worse health outcomes that are patterned across groups of people. And our data in Wisconsin starkly continue to provide evidence around these patterned outcomes. And this has showed up greatly in COVID-19. It's been a really intense case study that we are still living today on patterned outcomes by race and ethnicity. So here we see cases of COVID-19 being disproportionately bears the burden on our Hispanic and Latinx communities. So in the next three images, you'll see a similar structure on data. You'll see populations on the far left, percent of population, helping us understand proportion, and then percent of all COVID cases. And then the last bubble shows proportionate burden, disproportionate burden. So in this case, our Latinx community members have had the highest cases per 100,000, and that's disproportionate because they make up a smaller percentage of our population. On this slide, you'll see hospitalization data, and you'll see our populations mix a bit here, and our Black Wisconsinites rise to the top with our American Indian community members in second. And you'll see that disproportionately Black Wisconsinites are bearing the burden of hospitalizations, and American Indian counterparts not too far behind. And these are deaths. And again, you'll see our population sort of shuffle around again. And you see here our American Indian residents in Wisconsin bearing a disproportionate burden of deaths. And other than social and environmental and economic reasons that then shape our capacities to access resources and certain behaviors, we know, as our previous studies have shown in terms of how racism works, that structures these patterns and outcomes across communities, that there were many opportunities in our past that we could have rewritten policy to alleviate this disproportionate burden. And a part of some of the frameworks we use to describe those factors that shape health that are inclusive of health behaviors, but far beyond individual behaviors alone, is our social, economic, and environmental factors. And those things are what we often refer to in public health as those social determinants of health. So where folks live, learn, work, and play. And I think COVID-19 was another example of community members living in some places, playing in other places and jurisdictions, and working in other jurisdictions. Another really stark example of how our fates are really connected, that it's not just about one community serving the residents that live in a place, but also needing to consider who plays in our communities and who works in our communities, and where they go before and after work and play really make a difference on how we collectively can be well. And our pandemic that we continue to be moving towards recovery was a really good example of how, where we live, learn, and work and play is all connected in creating our collective abilities to be healthy and well. And those social and economic and environmental factors all shape our range of opportunities to have choices, and therefore have been shown to shape our ability to make good, healthy decisions, or our lack of abilities in some cases. So how does race, racism, and public health play out? And hopefully you're picking up on a theme here, that those factors that we just talked about, social, economic, and environmental determinants of health, those factors are racialized, and they create patterns and outcomes. And racism is that particular way those health factors are racialized. So racism is a system of, again, structuring opportunities and assigning value based on social interpretation, and again, creating different advantages and disadvantages on a population level in a patterned way. And this shapes, as you can see from this image, most, if not all, of our policies, laws, and practices that shape our everyday lives. So none of us are immune from the impacts of these racialized systems. And at its heart and its core, these racialized systems are creating communities of opportunity, which consistently lead to good health, and communities of low opportunity, which consistently lead to poor health. And we've been observing this in our communities for decades, right? The field of community development has been studying for a long time what creates vibrant communities. So when we look across literature and compare that and complement that with public health literature, we know very well that when we shape communities of opportunity, our communities are not just healthier, they're more vibrant, they economically thrive, there's better jobs, there's stronger social cohesion, social connectedness, and our low opportunity communities structured by policies fare worse on those short-term outcomes as well as our health status. And all of these systems have multiplying effects. So as a person walking in the world, we experience our transportation systems, our lack of a sense of belonging, segregation, housing, crime, poor quality education, lack of access, and often for communities of color, racism and other forms of discrimination. These arrows demonstrate that these individuals and populations experience these systems and aren't able to access the services and resources of those systems, but also the interaction with these systems cause stress. When you're interacting with systems that decrease your sense of belonging, that segregate you from others, when you're interacting with systems that have poor quality education, it's not just the system that's impacting you, it's also the stress response of interacting with those systems. So there's multiplying effects that eventually get under our skin and causes what we call in public health and health research chronic toxic stress. And this is starting to be studied widely. It's at the root of how we understand adverse childhood experiences, or ACEs, to create long-term trajectories of trauma in kids and in community members and populations. One metaphor that I like to use just to sort of illustrate that feeling of stress is driving in a blizzard. I don't know how many of y'all have ever been stuck on a highway needing to commute, on an hour drive, and the blizzard starts and things get slippery, your windows start fogging up and you can't see. So that white knuckle driving gives you a sense of that stress. Some stress in our lives is healthy for us. That fight or flight reaction keeps us safe. But if you continue to experience that stress over long periods of time, that gets under our skin again as toxic stress and begins to have physiological impacts on our bodies and our systems. And if you can imagine, if you're going through a really stressful time at work, that's when you're more likely to get sick. And if you get sick, you stay sicker longer. And you feel more sick, and it's harder for you to get well. And that's that constant persistent stress, that constant vigilance, or that constant white knuckle driving that you can't get out of. It begins to build up in our systems. And what we understand to be the Life Course Initiative is that this chronic toxic stress can also be passed down from generation to generation. If we do not mitigate the impacts of that kind of stress or trauma in one generation of a population, it does indeed get passed down. And this is what we've been observing for American Indians in the US who have experienced historical trauma that lives on today, and for Black Americans that are descendants of slavery continue to experience systems that are reproducing racism on a mass scale. So our opportunity, as we are observing right now in this moment, and as we've been building up to this time over the last many decades, is what we're striving for, especially from a public policy perspective, is thinking about policies of inclusion. Those policies that create low opportunity communities are what we can consider policies of exclusion, excluding particular communities from opportunity. So we can learn a lot, especially by looking at what happened with the disabilities rights movement, which continues today around curb cuts, for example. That curb cuts aren't just good for folks with disabilities, but they're good because they are policies centered around inclusion. And it's not just folks with disabilities that are benefiting, it's also families, those that are traveling with luggage, those that are pushing strollers, pushing grocery carts, that have a wide range of benefits. And similarly, if we can focus our thinking around policies to center inclusion, that is good for communities of color, certainly, but we've also observed that these policies are also better for families of all shapes and sizes, supports local economies, supports folks to age in place and have access to livable communities, those experiencing poverty, those with disabilities, those that have access issues to resources such as transportation, for women, those that are LGBT, youth, those experiencing mental health, and certainly has good outcomes also for our planet. So sort of coming back full circle, wanted to offer again the language that supports the justification of the racism as a public health crisis declaration. I've included some of those links for the sign-on information on our website. And we do ask that as folks sign on, that these are declarations are incredibly important, and we view them as a place to start and continue work around actions. So do list actions for organizations and coalitions as well as for individuals. So I know that was a pretty high level overview. I know you all have done a lot of work in West Allis, so want to also respect your wisdom and expertise and happy to take questions or listen in to throughout this agenda item.
Thank you for your presentation this evening. It's given us an opportunity to review the many programs that we offer to our low to moderate income residents and to seek new areas to assist the less fortunate than us. I had requested staff to document our initiatives to address the underserved members of our community and list some of the future goals that we have. I believe you were sent a copy of that presentation, as were all of the older people. It's a good reminder for all of us the need of the services that many people in our community have. Some of these programs have been initiated in the past several years. Others have been going on for literally decades. Our staff has done a wonderful job of bringing available federal and state grants and programs to our attention so that our residents can benefit from them. We have an active community development block grant committee for many years. Those funds have been used for such things as lead paint abatement, home security measures for low-income residents, ADA accessibility, home improvement loans and grants, and many other programs too numerous to mention. We have used HUD, Housing and Urban Development Home Funds, to build new homes for low-income home buyers. We have economic development loans and grants to help minority and low-income entrepreneurs. Our health department provides nutritional and wellness support to high-risk families, in addition to addressing substance abuse, mental health, and promoting healthy lifestyles. We have an abundance of affordable housing in West Dallas and have a number of initiatives to ensure the maintenance of our housing stock. We look forward to continuing these and expanding these efforts as new programs become available. We are not newcomers to the field of helping minorities and the underserved in our community. We've been doing this for many years, and we welcome any new programs that are brought to our attention. Our staff has really done a good job of this. Our one problem is, as a city, we have limited resources to do things on our own, so we rely heavily on state and federal funds and programs to do this, but we certainly take advantage of those programs when they're available. Thank you. Any other comments or questions?
Mr. President?
Alderwoman Keene.
Yeah, I just wanted to also, you know, this did bring light on actually a lot of the initiatives that we have. And I feel that we have a very good base. I mean, just a few is the Complete Streets policy, where the city is committed to fostering a livable city through the creation of complete streets that improve access to neighborhoods, prioritize safety and health for residents and visitors, support economic growth, improve access to education and jobs, enhance urban design, encourage physical activity, reduce negative environmental impacts throughout the city. We recognize that a safe, reliable, and comprehensive transportation network is right for all residents and visitors to West Dallas, regardless of ability, age, gender, race, ethnicity, income, and et cetera. Being part of the Community Block Grant Committee, I felt it was important to kind of call out some of the items that we do. I know Alderman Lysak kind of touched on it, but you know, we do have the supporting family strengthening community, where we alone set aside 16,000 program goals to connect low, moderate income families with necessary resources, provide services to assist in optimal development and school readiness skills for children under the age of 12. We also have the housing rehabilitation to help lower income with first-time homeowners with down payments, to help rehab the outside of houses. We have a Milwaukee County Outreach Services that we set aside $30,000 and focus to assist 30 individuals facing homelessness with case management, housing search, engagement. I'm not gonna go on and on, but you know, we have the Healthy Homes with the lead abatement, providing nutritional meals, the WIC program. So we have a lot, and I really wanna applaud the city for what has been done. I'm not saying we can't maximize. I do think one thing we can focus on is potentially more education, so our residents are aware exactly what they have at their fingertips to truly take advantage of these programs. But I will say that I do feel West Dallas has done a good job Doesn't mean we're finished and we can't maximize on what we already have, but I did want to applaud where I feel we are at.
Anything else come before the committee? Hearing none, thank you for your presentation. Is there a motion to adjourn?
Second.
Any discussion? All in favor?
Aye.
Opposed? Carried.
Good evening, everybody. We are going to call the May 18th meeting of the Common Council to order. I will ask the clerk to call the roll.
Thank you, Mayor. Tonight we have Alderman Haas.
Here.
Keen. Here. Lysick.
Here.
Reinke.
Here.
Rote.
Here.
Stefanski.
Here.
Tenorio.
Here.
Weigel.
Here.
Oh, I have Lysick twice. Grisham.
Here.
And Mayor Devine.
Here.
What about
We have a
me?
quorum?
What about me? You forgot about me.
Vitale, I apologize.
It's okay, no problem. I mean, I
Save the best for
forgot.
last.
It's the first inning.
That's okay.
Let the
I
pitcher,
put it out
let
of
the
the way
pitcher
right
warm
away.
up, Vince.
Try to warm me up a little bit.
We have 10 present, we have a quorum. If you are able, please rise and join us in the Pledge of Allegiance, which will be led this evening by Alderman Haas. Okay, we have no public hearings under item D this evening, so I will go right to item E, which is citizen participation. This is a chance for residents to address the council on matters of interest to them during this 30-minute period. Each speaker must announce his name or her name and address to the council, and we ask that you limit your comments to statements of no more than 5 minutes. Is there anybody who wishes to address the council under citizen participation? Please come up to the podium.
Just give me a second, I'm a little slow here. I got
Take your
a
time.
Race on the lake, too. Okay, let me get it here. My name is Lawrence Borick, and I live on Waukesha Road. You know, in terms of West Ellis, I actually started in West Ellis way back in 1956. I started my apprenticeship at Ellis Chalmers, so that's a little while ago. I've been a resident of West Ellis for over 60 years, a homeowner, again, for way over 50 years, and 40 years out on Waukesha Road. So, in other words, I'm a little bit familiar with the city right here. I guess my talk is on this closing of the Root River Parkway between Oklahoma Avenue and Morgan Avenue. And I got one fundamental question here, and basically this question, I got a son who happens to be a state trooper, and I brought this up, and he says, well, what, and this is basically what he said, what problem is being solved by closing this? What problem's being solved by closing this? Versus what problems are being created by closing this parkway? You look at it, by closing the parkway, you're not making it more accessible to anybody. Anybody can walk there right now, but what you are doing is limiting access to people who cannot necessarily walk, have to use a car or something to enjoy that parkway. I'm one of those people, by the way, too, as you can see with this walker right here. So what you're doing is cutting out the access of a lot of people, but you're not gaining any people by closing the parkway. So to me, it's a zero-sum game in a way. Like I say, denying access to anybody but by closing the parkway, basically it just denies access to anybody that's got limited mobility, that has to enjoy it by using a car. And about halfway down, some of you may be familiar with the wildlife area there. And, I used to go look at it too till last summer when the parkway was closed. And when it was closed, I first thought, well, they're probably doing some construction on there, so let it go. And then later on, when it was finally open toward the end of the summer or fall, I drove by and said, what did they do? Only to find out this was what called Active Streets program. Then last Sunday, I went up to 116th Street there and talked to people. And at 116th Street, it kicks off the parkway, just where the close. And every one of them that I talked to was irritated last year when they found out the reason for closing it. Basically, they all had the same idea. They thought there was some construction going to be going on or being done. But when they heard it's going to close again, they were not happy campers, I can guarantee you that. Also, another thing here, if the city insists on closing this parkway, is the city going to put detour signs for people? You get a lot of people coming either down the Root River Parkway southbound or up 106th Street northbound, and all of a sudden here's a blank, road closed. If they're not familiar with this area, what do? Do they go left, do they go right, or what? And with that construction for the Waukesha water main, that just adds another dimension of messiness to this whole closure right there. So basically, people got to either go east to Highway 100, west to 119th, or 124th Street. And by the time you go around, and I kind of paced it a little bit with the car, it's a couple-mile detour, right there. So again, are you going to put signage there? I would think if, it's a realistic thing to put, detour signs around for people that aren't familiar with the area, and I'm not sure if there is, but is there any legal road requirement that when you detour a road, you have to put signage for a detour so people know which way to go?
I know we've traveled and we've gone through some towns and all of a sudden the road is closed and where do we go? No idea. They just say road closed and there you sit in the middle of, where do I go, left, right, or what? So, that's another thing to consider. Put detour signage up for people so they know what the heck is going on. Yeah, I got a few more things here, if you don't mind. I talk a little slow right here with this. What about emergency vehicle access going down, especially for those 5 houses or whatever are on 116th Street? Right now, for the fire trucks, they can go down Highway 100, National Avenue, turn a left, and get right back to it. With the detour, they're going to have to wig-wag all around the place to get to that place. What about, EMT services? It may take only a minute or two longer, but that minute or two longer, I can tell you from my own heart, makes a big difference as far as, what condition you wind up in. So again, and what about, here's another thing I've been looking at right here. What about the DPW trucks that normally come down National Avenue and go to the recycle center, the Morgan Avenue? Instead of being able to directly go there, they're going to have to detour around probably a couple, 2-3 miles to get to that same site, which also means if you look here at the cost of operating one of those vehicles, I would say it's $1 a mile or more when you look at fuel costs, maintenance, and so forth. Every one of those trips is adding some more dollars to the budget. It's sort of hidden, nobody sees it, but it's sort of buried there in downline costs. So consider that thing also. Plus, the parkway's got an 8-foot wide grass strip on either side, besides the full width of the parkway, which is a good 3 cars wide. So what do we got to close the parkway for? There's plenty of play area there.
Mr. Boric?
Yes.
You're at 5 minutes, so if you can kind of wrap up the...
Okay, can I mention a comment?
Yep.
Talking to you the other day on the phone?
Sure.
Yeah, here, I got some notes here I was taking right here. In talking to you, you seem to indicate how excited your neighbors were about the closing. Are any of your neighbors really affected by the closed road? No. If they go south, they just drive south from Orchard Hills to, Morgan? Or they go northbound, they go north to Oklahoma. I bet most of them have never really used that parkway to any degree. So certainly it doesn't impact them. Why wouldn't they be excited? But, also then I looked at this survey I got, 40-page survey. Somebody say, I don't know who told me they did that big survey. And I tell you, when I go through this survey and try gleaning information, there's an old term, and it comes up with this, gobbledygook. I got a master's degree also, and I have a problem reading this thing and say, what are they talking about? So I guess my big question is, what are you closing the parkway for? What problem are you solving versus what problems are you creating?
Thank you for your comments. Does anybody else wish to address the council under citizen participation this evening?
Hi, my name is Joanne Boric, and we live at that Root River Parkway on Waukesha Road off of Oklahoma. Mine will be a lot shorter, but can I give the extra time to Larry if he needs any more?
I don't think we can do that, I'm sorry.
Okay.
It's not like Congress.
Here are my concerns on the active street program from Oklahoma to Morgan Avenue. The street is wide enough for a car to park. It has 8 feet shoulder on each side. People can park, ride a bike, walk a dog, or just enjoy nature. Bike trails are on the south side of Morgan Avenue, and 5 cars can park there, and there's a 25-mile speed limit in that area right now, okay? If this section is closed, it would be difficult for anyone to park on 100 for that 1 hour time and then try and go on that closed parkway because the traffic is so busy out there on Oklahoma. You probably wouldn't want to stay there and get out and then go in and participate in that program. There is a dead-end street at the north of National on 116th between the church and the east side of the river. I walk there during the day and in early evening, and it's safe and accessible. I mean, it's there right now. We would need this parkway open in order to take brush off to that center there. And since the COVID restrictions seem to be coming to a close now, so people could really go take their children to enjoy other places to area parks. There is no convenient way to go around the closed parkway. More people can enjoy the parkway if it remains open. This includes people with mobility issues. So please keep the parkway open, and thank you.
Thank you.
Hi, I'm average citizen Ed Lasinski. I live at 3364 South 119th Street. Just wanted to step up here for a second and just let the council know about a few community organizations that have some really cool stuff going on right now that I'm very involved with. So the first one, the West Dallas, West Milwaukee Old Timers Baseball Association. If anybody grew up in West Dallas, you guys probably remember the t-shirts from the playgrounds. We're still out there. We still do the t-shirts for the playgrounds. This Saturday, we actually have a free baseball and softball clinic going on at the West Dallas Athletic Facility behind Hale High School there. So any kids between the ages of 4 and 12 are allowed to come out. It's free. You get a free lunch. We have the varsity baseball and softball teams from Hale and Central are going to be out there actually running the kids through some drills. It's really cool, free program. Just want to give a shout out to the West Dallas Wolfpack, the West Dallas Little League, the rec department, and Shaw Funeral Homes for their donations and their help with that event. You can sign up through the rec department. Another group I'm with, the West Dallas Historical Society. Our museum is back open now. So we were shut down a little bit for COVID, but now you can stop by again. The museum's open actually right now, Tuesday nights from 7 to 9, and then Sunday afternoons from 2 to 4. So you can come out, and we've got a couple new displays and everything. So if you haven't been there in a while, or if you've never been there at all, I definitely encourage you to stop by. The West Dallas New Berlin Relay for Life is going to happen this year. So last year we were shut down. If you're not aware of Relay for Life, it's another great event raising money for cancer research. That's going to be July 16th, again at the athletic facility behind Hale High School. I'll just read this real quick. If you don't know what Relay for Life is, Relay is a community event to celebrate our cancer survivors and honor those we've lost. We gather to celebrate, remember, and fight back by raising funds for the American Cancer Society. Basically, teams of, if you haven't experienced that before, basically what happens is you have different teams that come out there and they try to keep somebody on the track going around all night long. It used to go all night, now we actually stop it at 2 in the morning, but that's just because we found everybody kind of left at that point. But we do try to keep somebody out there. There's music, there's games, there's silent auctions, there's all sorts of stuff. You have 3 ways to participate. You can join a team and be out there and support that way. It's a free event, so anybody can just show up anyway and come on out and donate some money and have a good time. And then obviously you can just make a straight donation if you want. We take cash, we take silent auction items, we take just about anything. So you can just do a Google search for West Dallas, West Milwaukee Relay for Life. It's on Facebook, it's on Google. If you do donate, Team Jim is my family's team, honoring my father. Some of you might know from the Plan Commission, and I think he's on the Community Development Authority right now. So he's a cancer survivor since 2012. So another great event right there. And last but not least, not really an organization, but I just want to say May is Building Safety Month. So thanks to Mayor Devine for proclaiming that. Governor Evers also proclaimed it for Wisconsin. It's a great event nationwide where we go out there, we promote building safety. This week right here, each week has a different theme. The first week was energy conservation and innovation. The second week was preparing our next generation for the future. This week is water safety. So if you appreciate clean water to drink, that's what we're promoting this week. And then next week is disaster preparedness. And I think I ran out of my 5 minutes, so thank you very much.
Thank you for your comments, Citizen Ed. Does anyone else wish to address the council under citizen participation this evening? Okay, seeing none, we will close citizen participation. We will move to item F on your agendas. Our standing committees will be meeting during recess. That room number is listed on page 1 of your agenda. Going to item G, the mayor's report. I have 2 quick things. I don't have the exact dates in front of me, but just piggybacking off of what Citizen Ed shared with us regarding the Historical Museum, we do have a series of traveling beer gardens coming to West Allis this summer by 1840 Brewing Company, and they are going to be setting up on some weekend evenings at Honey Creek Park, and the museum will be open for those as well. So if it takes a cold beer in summer to get you to the Historical Museum to take a walk through, there's a little extra incentive. I think they have about 5 dates starting in May and going through September. So that's, and they did agree to make some type of contribution towards the Historical Commission as well. And the other thing I just want to quickly mention is that I believe it's the official opening of the new Festival Foods is going to be at 6 o'clock in the morning on Friday. I think there's a small ceremony Thursday night, but the grand opening is at 6 a.m. Friday morning. That does conclude the mayor's report. Do we have any reports from the alderpersons?
Mayor Devine?
Alderperson Keene.
Some might have seen, but I just wanted to welcome a business to District 3 that happened over the weekend, Legacy Cuts, on 84th and Washington. It is a barber shop. They do have a stylist, so they can take care of all needs. They did a beautiful job on the inside, and I just wanted to welcome them and Mr. Robinson to the city of West Allis and let them know that we're happy to have them.
Right. Thank you. Any other reports from the alderpersons?
Mayor Devine.
Alderman Lysick.
I move for approval of the minutes of May 4th, 2021 Common Council meeting.
Second.
There's a motion and a second. Are there any changes to the minutes from May 4th? Hearing none, all in favor?
Aye.
Opposed? Ayes have it, the minutes are approved. Item J, Standing Committee Reports, License and Health Committee. Alderman Vitale?
Yes, we have item 2, 3, and then 4 was for denial, and 5 was for denial, and then 6 was from the police department to place it on file. So I move of the approval of the License and Health Committee reports.
I'm going to ask our Attorney Decker is up.
Mr. Mayor, the applicant under number 5 for John Star Pickles LLC, Broken Star, arrived late, and so there was a request to refer that matter back to committee. So the motion to approve is pending. If assuming the council wishes to do so, a motion to refer item 5 back to committee would be in order at this time.
Okay, do you want to amend your motion, Alderman Vitale?
Well, the was discussed. The applicant actually was requested to be here, but he never showed up.
Well, he's here now.
Oh, he's here now?
Yeah, so that's why we're asking if we can send item 5 back to committee.
Oh, I don't know that. I mean,
Yeah. So is that a yes?
then we can send back to
Okay.
committee again.
So then we'll approve the balance, and item 5, instead of a denial, we'll be referring it back to committee.
Yes, yes.
Okay.
Mayor Devine?
Was that Alderman Rote?
That was Rout, yes.
Yes.
Item 3 was held, correct? Alderman Vitale?
Which one?
Item 3?
Item 3.
Yes,
I didn't hear that part. Okay.
yes,
So 2 approved, 3 was held. Okay.
that's
Thank you.
right.
Okay.
And
And
4
Mayor
was
Devine?
denied it.
Alderman Haas.
Yeah, item 4 was to deny. Was that a unanimous
Yes,
vote?
that was the,
Okay.
well, I vote no.
It was 4-1 denial.
4-1 for
Well, then
denial.
we need to separate that if it's not unanimous. So
No, it's not.
Okay.
I call for a separation of item 4.
Okay. So we are now going to vote on items 2, 3, 5 to committee, and 6 to place on file.
Place on file, correct.
Okay. Is there any other discussion?
Can you repeat that, please?
Items 2, items 3. First one's approved, second one is held.
Yep.
Item 5 is back to committee,
Mhm.
and item 6 is placed on file.
Okay.
Any other discussion? If there's no discussion, I will ask the clerk to call the roll.
Alderman Haas?
Aye.
Keen?
Aye.
Lysick?
Aye.
Ranky?
Aye.
Rote?
Aye.
Stefanski?
Aye.
Tenorio?
Aye.
Vitale?
I vote aye just as well. Thank you for addressing my name.
You're welcome. Weigel
Aye.
and Grisham.
Aye.
Thank you.
10-0, motion carries. Now we have item 4 in front of us, which was a 4-1 vote. Make a motion to approve that recommendation. Alderman Vitale?
Yes, I'll make a motion
Okay.
to approve the recommendation based on the License and Health Committee reports
Okay.
for denial.
So it came out of committee with a 4-1 vote to deny, correct?
Yep.
Okay.
So an aye is supporting denial.
An aye is supporting denial. Yes, thank you. If there is no discussion on item 4, is everybody on the same page? Okay. I will ask the clerk to call the roll.
Alderman Haas?
No.
Keen?
Aye.
Lysick?
No.
Reinke?
Aye.
Rote?
Aye.
Stefanski?
Aye.
Tenorio?
No.
Vitale?
Aye.
Weigel?
Aye.
Grisham?
Aye.
All right.
Is that 7-3 or 6-4?
Excuse me.
7-3.
7-3. Motion carries.
That's democracy, Mayor, right? That's part of the process, democracy.
Now we'll move on to item K, consent agenda. Alderman Lysick, do we need to suspend the rules?
Mayor Devine, I'd like to pull out item 16 to vote on separately.
And Mayor Devine,
12.
I'd like to pull out item 12 to vote on separately.
Okay.
I would then move for approval of the consent agenda as presented, with the exception of items 12 and item 16.
Okay. We have a motion. Is there a second?
Second.
Second by Alderperson Keene. If there is no discussion on the balance, I will ask the clerk to call the roll.
Haas?
Aye.
Keen?
Aye.
Lysick?
Aye.
Reinke?
Aye.
Rote?
Aye.
Stefanski?
Aye.
Tenorio?
Aye.
Vitale?
Aye.
Weigel?
Aye.
Grisham?
Aye.
10-0, ayes have it. Motion carries. Now we have item 12 before us.
Yeah, Mayor Devine?
Alderman Haas.
Yeah, and to fill the rest of the council in on this, we heard from the folks during the public comment, this is a proposal to close portions of the Root River Parkway. It's completely within the 5th Aldermanic District. This was done last year. There's work by our staff to do it again this year. Alderperson Reinke and I have been working very closely together in this, and candidly, initially, I was in favor of this proposal, and I want to recognize the hard work of our staff, in particular Tony Gyron, in bringing this forward. However, there has been a strong response from our residents, a strong response from our citizens, and we need to hear from our citizens. We need to listen to our citizens. Consequently, I feel strongly, along with our residents, our citizens, that we should not proceed with the Active Streets program. And so this would just maintain the status quo, that all portions of the Root River Parkway would be open to vehicular traffic just as they are currently. And so I want to soften this, if I can, by not having us make a no vote, and accordingly, I move that we postpone indefinitely item 12. That's the same effect of a no vote without actually taking a no vote.
Second.
I'll second that.
Oh, sorry.
We have a motion, and we'll give the second to Alderperson Reinke.
Appropriate.
Is there any discussion?
Mayor Devine?
Alderman Weigel.
I would like to add that I'm a frequent user of the parkway there in the summertime, as well as they do an Active Streets program up, I believe it's along the Little Menominee River, up around Mill Road. They do the same thing there. They close off a large section. And they do the Active Streets things in the city of Milwaukee and other places too. And I believe in some locations, it works very well, and it's a very good program to do. I was always a little questionable about this location because there's not a lot of citizens who live right there that would become like an extension of their front yards, and the neighbors would gather like you see at other ones. And so I am in favor of the program in general. I guess I too will be voting aye in this case to leave it or suspend indefinitely. So again, I like the program. I just don't think it's the right location.
Thank you, Alderman Weigel. Any other discussion?
Mayor Devine.
Alderperson Ranky.
I concur with Alderman Haas on this particular situation. We do want to soften it for our residents. But along with that, we certainly appreciate our staff presenting new ideas to us. Last year, we felt it was successful. This year, there are several new developments that have occurred that caused the residents some concern, a lot of concern. This last week, we've received many, many calls and emails regarding this particular project. All stated they were against this program at this time for various reasons. Traffic has been impeded because of the Waukesha water situation locating there, and the road conditions are a deterrent basically for traveling for especially the residents in that particular area. Also, the inconvenience to the residents is a concern to them, as well as the road conditions of the parkway itself. There's many potholes, and basically they could be redoing their road to make it a lot safer for our walkers and our bicyclists. Unfortunately, they work very slowly, and I don't see that happening for this year anyway. Certainly, we encourage the walkers, and there still will be walkers because they are walking currently. There's bicyclists every day doing the parkway, and it's a nice area. However, because of the conditions that are currently there, we have reached, you might say, the situation at hand is not conducive to this happening for this year. And we thank the residents for stating their opinion and coming up before council to let the other colleagues know how the residents at large are feeling.
Thank you. Any other discussion?
Mr. Mayor.
Alderman Vitale.
Yeah, of course, I mean, that's out of the boundary, you know, I mean, in the 5th district. But the Milwaukee, I mean, I would like to have more clarified. Is that the Milwaukee Initiative, Milwaukee County Parks Division, that they wish to closure of the parkway, or just was something discussed between the two the entity, you know?
And Mayor, I can answer that if you like.
Yeah, go ahead.
Go ahead, Alderman Haas.
Yeah, it's a City of West Dallas initiative, but on Milwaukee County parkland, of course.
Okay.
So it's from us, it's from the city.
Okay, thank you, Alderman Haas.
Any other discussion? Hearing none, the motion before us is to postpone indefinitely.
Correct.
If there's no other discussion, I will ask the clerk to call the roll.
Haas?
Aye.
Keen? Lysick?
Aye.
Reinke?
Aye.
Rote?
Aye.
Stefanski?
Aye.
Tenorio?
Aye.
Tally?
Aye.
Weigel?
Aye.
Grisham?
Aye.
10-0, motion carries. Now we have item 16.
Mayor Devine,
Alderman Lysick.
I would like to make a motion to approve the resolution on item 16 so that I can make an amendment to it.
Okay. Is there a second?
Second.
Second by Alderman Weigel. Alderman Lysick.
Mayor Devine, I would then like to amend resolution item number 16, the last paragraph where it reads, "Be it further resolved that approval of the attached amended development agreement supersedes," and I want to strike the following, the approval of any and all other prior agreements between the parties, and any such prior approvals are null and void, and replace it with only the amended sections on the document. So only the amended sections of the document would be null and void. All previous executed terms and conditions not referenced in this amendment remain in place. So I would move for approval of the amendment.
Second.
There is a motion and a second. Is there any discussion on the amendment? Hearing none, I'll ask the clerk to call roll.
Haas,
Aye.
Keen. Aye. Lysick.
Aye.
Ranky.
Aye.
Rote.
Aye.
Stefanski.
Aye.
Tenorio.
Aye.
Vitale.
Aye.
Weigel.
Aye.
Grisham.
Aye.
10-0.
Okay, the amendment passes. Now I believe we vote on it as amended. Does that need another motion?
The motion was made already.
Okay. So we had the motion by Lysick and the second by Weigel. Okay. Any discussion on the amended resolution? Hearing none, I will ask the clerk to call the roll.
Haas.
Aye.
Keen. Aye. Lysick.
Aye.
Ranky.
Aye.
Rote.
Aye.
Stefanski.
Aye.
Tenorio.
Aye.
Vitale.
Aye.
Weigel.
Aye.
Grisham.
Aye.
10-0.
10-0, motion carries.
Mayor Devine,
Alderman Lysick.
I move we stand in recess until conclusion of the committee meetings.
Second.
Before we vote on that, I see our attorney is up.
Mr. Mayor, since item 5 was referred to committee, the council could, or the committee could technically take that issue back up during this recess and come back with a finalized decision. If the committee wishes to do so, then you just need to announce that the License and Health Committee is going to be meeting during the recess and where it's going to meet.
Okay, I will announce that with the nod from the chairman.
Yes.
That's the nod, okay. What room will you be in? Do we need to announce the room?
Well, I mean, I don't want to disappoint some of the
have
other.
on the agenda already, room 128.
128 for
Is
finance,
it
so-
okay to switch that at this point?
Otherwise, we can do it right here.
Honestly,
too.
you each have one item. Could you do one in here and one in there? Yeah.
License can be right in here.
Yeah,
So
we can
License
do it
and
right
Health,
here, really.
License and Health will be meeting in the council chambers, and Administration and Finance will be meeting in room 128. On the motion to recess, all in favor?
Aye.
All opposed? We are in recess.
License and health is just.
Thank you, Mayor.
Yeah, you got enough for everybody here on top. Oh, boy.
That's funny.
But it was so busy this weekend that she went someplace else, so that's a positive thing. That's so successful, so busy. Well, he has his license, our dog does.
And a dog park pass or just a license?
That's what I mean, yeah, dog park pass and the dog license. Okay, so the Administration and Finance Committee will come to order, and all 5 members are present. We have one item to address, that's item 28, a resolution approving closeout transfers in the general fund for the fiscal year. And we have an amendment, which we'll deal with in a moment, but can I have a motion to approve item 28 before we go on to the...
Motion to approve item number 28.
Second. We have a motion and a second. And then each of you, except for Alderwoman Keene, sorry, we have an amendment, which is just an addition of the clerk's department carryovers in the amount of $68,973. Can I have a motion to amend item 28?
Move to amend to include the clerk's department.
Second.
A motion and a second on that. And then any discussion on the amendment? And then on the amendment, all in favor, say aye.
Aye.
Opposed? All right, the amendment is approved. And now on the whole thing as amended, we already have a motion. Any discussion? All in favor, say aye.
Aye.
Opposed? The ayes have it. All right, so item 28 is approved as amendment, as amended. And all in favor, say aye.
Aye.
There we go.
Efficient government.
Works there.
Good evening. We will call the common council back to order, and I will ask our clerk to call the roll.
Haas.
Here.
Keen. Here. Lysick.
Here.
Reinke. Here. Rote. Here. Stefanski.
Here.
Tenorio.
Here.
Vitale.
Here.
Weigel.
Here.
And Grisham.
Here.
10 present, we have a quorum. We will start with the Administration and Finance Committee, chaired by Alderman Haas.
Yeah, Mayor Devine, I move for approval of item 28 as amended, and the amendment was simply to add the carryover from the clerk's office.
Second.
There's a motion. I'm just remembering our supplemental agenda.
Yeah, they were part of the consent.
That was in
agenda.
consent.
I only know that because Alderperson Reinke already told me.
Dodged a bullet there. Okay. Any discussion on the Administration and Finance Committee report? Hearing none, I'll ask the clerk to call the roll.
Haas.
Aye.
Keen. Aye. Lysick.
Aye.
Reinke.
Aye.
Rote. Aye. Stefanski.
Aye.
Tenorio.
Aye.
Vitale.
Aye.
Weigel.
What? Aye.
Why? I give an eye.
10-0, motion carries. Next, we have one item from the License and Health Committee. Alderman Vitale.
Yeah, we have item 5, the committee member of the license to reconvene in session. The temporary premise extension for John Star Pickle LLC, DBA Broken Star, was approved by all the members of the License and Health.
Just need a motion to approve.
Approved, yes.
All right. So motion to approve. Any discussion? If there is no discussion, I'll ask the clerk to call the roll.
Haas.
Aye.
Keen. Aye. Lysick.
Aye.
Reinke.
Aye.
Rote. Aye. Stefanski.
Aye.
Tenorio.
Aye.
Vitale.
Aye.
Weigel.
Aye.
Grisham.
Aye.
10-0.
Motion carries.
Mayor Devine,
Alderman Lysick.
I move that we adjourn until our next regularly scheduled meeting, Tuesday, June 1st at 7 p.m.
Second.
There's a motion in 4
Everybody say
seconds.
second.
All in favor?
Aye.
Opposed? We are adjourned.